Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, this program focuses on different healthcare issues, services, and programs provided by KRMC that will be of interest to you and your family. I've got a great guest on the program today, so stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Anthony Lemansky. Thanks for being on the program today, Doc.
You're welcome.
And your specialist is OBGYN, obstetrics and gynecology, right?
Yes, ma'am.
Okay. So you've been in Kingman a while. How long have you been here?
I've been here a little bit over 16 years.
Wow.
I got here in 1996 in May.
Okay.
So I've been here ever since and
You've seen a
practicing
few
OBGYN.
changes. In 16
Occasional
years?
changes,
Yeah.
yes, definitely.
And then that means you've delivered an awful lot of babies. Do you keep track?
I kind of keep track. I'm somewhere between 6,000 and 6,500.
Wow, that's a lot of babies.
That's a lot of babies.
And you're part of the, it's Kingman OBGYN Associates now, right? That's
Correct.
their new name. So your partner, there's 3 of you, 4 of you?
There's actually 4 of us,
Okay.
Dr. Jackson,
Okay.
Dr. Taylor, and Dr. Tedesco and myself.
Okay, very good. And the 4 of you, so you take turns kind of on call, so you're not all having to get woke up in the middle of the night.
Oh yes, we've shared call from actually the time I got here.
Oh, that's good.
Oh yes, it is.
Yeah.
Definitely. Babies do not take appointments.
No, that's true. They don't, and they usually come at the most inconvenient times.
It would seem that way.
Yeah, it seems like from what I've heard and seen myself, it's like just before a storm. Things like
in
that.
the middle of the night too,
Middle of the
2 and
night.
3 in the morning is a
Right.
very popular time for delivery.
There's just something about that. Wake everybody else up. I'm here. Right?
Absolutely.
Well, that's pretty cool. But one of the things I wanted to talk about on the program today is another kind of subspecialty of yours, and that's hypnosis.
Well, let me tell you a little bit about what I've done with hypnosis and
Okay.
why I initially got into it. I have a daughter who now has graduated from college, but back then she was in high school, and she was one of these kids that could, bring home A's and all her reports and other stuff, but she would take a test, and she'd end up with a C.
You kind of freeze up sort of thing?
Pretty much so.
Yeah.
It was, my thought was, well, maybe you're not studying enough.
Right.
But then I looked at her other tests and other such. The tests were the problem, not her papers, not her daily work. So it was interesting that week I got a card in the mail. And it was a little card saying, train as a hypnotherapist or a hypnotist. And this was out of Phoenix. And I'd thought about that for some time. The year before, my wife and I were on a cruise ship, and we saw a stage hypnotist.
I was just going to say, you must be fun at parties. No,
Well, it's interesting.
that's a whole different thing.
That people who do stage are actually very good hypnotherapists or hypnotists, and the people who are up there on stage self-select. They don't go out there and just pull anyone out of the audience. They can tell, and they choose those people who seem to be the most suggestible to be up on stage. But I saw that, and it was interesting that I knew that I couldn't listen to this guy on stage because I was going to be one of those people on the stage. And so I decided not to do that. But it did intrigue me. And sure enough, not that long after getting back, and with my daughter's phobia of tests, I got a little postcard in the mail asking if I wanted to be trained as a hypnotist.
Interesting.
And this was done down in Phoenix. Don Rice and actually 2 other physicians who were also hypnotists did the training.
So it's a medical training. It's not like a card hypnotist kind of thing. This is...
Well, it's interesting that the organization I belong to is primarily non-professionals. In other words, not physicians, not psychologists, even though they have quite a number of them in the National Guild of Hypnotists, the NGH.
Okay.
And it was part of their training, and I'm certified by them.
Okay.
So I went down and trained primarily to help my daughter with test anxiety.
Okay.
So I came back, and I can say now that some years later, she's graduating with a 3.8.
Excellent.
and-
So obviously it worked.
Well, I'm not sure I'm going to take all the credit for that, but whatever it did, it helped her get through this stage in her life and on to something else.
Cool. That's very cool. So hypnotism has many different aspects to it, or different things it can help with. Like you said, the fear of testing. What other types of things have you used it for?
I could probably go on for a half an hour just pointing things out. And people do some things that are a little bit off the wall with it. There are people who do past life regression.
Oh, right. Yeah.
There are some people who can actually use it for full anesthesia. But for the most part, the certified hypnotists are primarily doing things like test anxiety. They're doing things like smoking cessation. There's a big push in the industry now of virtual lap band. In other words, virtual lap band. One of the men I was trained by is doing this down in Phoenix. And he uses 3 or 4 sessions, and basically he performs a hypnotic lap band for weight control.
So you believe that you're not hungry or something?
Well, understand that the lap band and the Roux-en-Y, which is the stomach stapling, and the gastric sleeve are all forms of forced starvation.
Right.
We don't necessarily want to call it that, but that's what it is.
Yeah, because you're not eating enough to sustain yourself.
That's correct. The problem is, psychologically, there's a lot to adjust to, but you don't really have much choice because you have something mechanically done to your body.
Right. That's not giving you any room for food.
Absolutely. If you can do this in your mind, his thought is that you will be just as successful without having gone through any surgical procedure.
Wow.
And it's right now there's probably, I've seen advertisements for 3 or 4 different groups who basically teach their technique, use their scripts and other such for that.
Well, you know, it makes sense because even if you haven't mentally prepared yourself for after the surgery, I've heard this from other people, they're not successful. So there's something about having to mentally adjust to it. So then that's pretty cool.
It is, and it was kind of an interesting thing that I felt was probably a good start. My problem with it is I know the literature on lap bands, and lap bands are dismal after 10 years.
Oh, yeah.
After 10 years, the amount of weight loss is probably not significant. Yes. The only one of the procedures that really works well is the Roux-en-Y.
Which is the stapling?
Which is the stomach stapling.
Okay.
And so it's the idea, if you're going to do something virtual, I would do the virtual Roux-en-Y.
Yeah.
I wouldn't do a virtual lap band.
Lap band.
And part of the problem is, though, that as part of the hypnosis, you end up actually doing a virtual surgery. To my way of thinking, it takes a non-virtual surgeon to do that. So in terms of a Roux-en-Y, I could probably describe that better. And then at some time I thought about doing that and doing my own script associated with that.
You want me to be your guinea pig? No.
Well, I haven't gotten that far with it. Again, one of
well, let me know when you do.
One of my projects I've been doing. The other things, though, that I think are important and that can be done very, very well. There is a hypnotist in Kingman. He lives on the outskirts of Kingman, and he does mainly group sessions. Group sessions don't have a real good success rate overall. If they're inexpensive, I would tell people to try one. But for most people, individual hypnotherapy is still the answer.
Yeah,
but the biggest thing, of course, is smoking cessation. Smoking cessation works very, very well. In individual sessions, it's between 70 and 85% successful.
Well, that's really pretty good. When you combine that on top of, the will to quit, wanting to quit, right, to begin with.
And therein lies the problem. If someone really wants to quit, and I tell patients every day, well, if you know why you smoke, you can throw them away tomorrow. There is no such thing as nicotine addiction.
Oh, there isn't?
Of course not. If there were nicotine addiction, wouldn't you have to send everybody who was on patches and gum to the clinic to get them off the nicotine? When they get through with them, they throw them away and never use them again. No, the addiction is psychological.
True. Okay. I'm an ex-smoker myself,
Well,
so
you understand them.
Yeah. I mean,
You
they were my
understand
best friend.
why your car wouldn't start without a lit cigarette.
Right,
The
yeah.
phone couldn't ring or be answered
Right.
without a lit cigarette.
Right.
And by God, a meal couldn't be done until a cigarette was done.
That's right.
So we're dealing with habits, but we're also dealing with people who started a habit way back when.
Right.
And as part of the smoking cessation, you often will take people back and regress them back to that first cigarette.
Okay.
And some
why
people
they
tell
do
you,
it.
oh, I know exactly when I started smoking.
Yeah.
Oh, my parents got divorced and I was in my 20s. And then you regress them back and find out, oh, no, when they were 14,
Oh,
they
Yeah.
and a friend
mentally forgot
stole a
that
pack
one.
of cigarettes from 7-Eleven, and that was the first cigarette. And there may be some guilt and some other stuff associated with it. But if you can convince them that they no longer have that reason to smoke, they can throw their
them away.
cigarettes away.
that's amazing. So,
And,
well, I was just thinking how, I mean, because smoking cessation is something that insurance doesn't cover. You know, you can have classes and all that kind of stuff, but the health improvement that comes from quitting smoking, you know, for myself, it was huge. It was a major task, though, for me. It was a challenge. I'm thinking, oh, this could have probably made it a whole lot easier.
Interestingly enough, I had a couple of nurses. One that smoked and had 50-pack years. Another was 60-pack years.
Wow.
For
Yeah.
them, they were motivated. One session, they both are not smoking 2 years later.
Awesome. So it has long-term results, too. It's not just a matter of I'm not going to
Correct.
smoke today, but then tomorrow I do.
Correct.
That's amazing.
It is, and what we don't realize is that we all are in hypnosis on a daily basis.
Okay, that's interesting. Tell me more.
Well, if you've ever been watching a movie or a show and all of a sudden you're crying,
Yeah.
you're into that movie. You're in hypnosis. You're
True.
in that. If you've ever, I had children, so I remember driving home upset about something they had done, but I don't remember a single turn. How did
Oh.
I get home? My subconscious got me home. So, or you're on a freeway and you're thinking about something, your exit is back there.
Right. Didn't
Again,
even realize you passed
hypnosis. So we all slip in and out of hypnosis on a daily basis. All a hypnotherapist does is teach us to utilize it and teach us to use it for de-stressing or for anything that
Okay.
affects our lives. Phobias are a big one too.
it. Right. okay.
I've traveled all around the world.
Mhm.
I lived in Europe for 3 years,
No.
and I hate to fly.
That's a little hard to get from here to there without flying.
Yes, swimming the oceans was very difficult. So what I do to this day, when I get on a plane, and I use a kind of a safe place, and this is what I instruct all my hypnosis clients on. And so I touch my forehead, and I basically walk down these stairs, and I get into my stainless steel little house, if you will.
Uh-huh.
And I'm there the whole flight. That plane can be bouncing up and down, doing this, that, or the other. It doesn't bother me at all.
Interesting.
And
No,
I can be talking to people.
I was
doing
just going to
anything.
ask you, do you
Yes, I'm not-
function
yes,
as if you weren't
Yes,
hypnotized?
but if the plane starts bouncing around and I want to go to that safe place, all I do is close my eyes.
Interesting. Okay, we're going to talk more about that. I want to learn more, but we've got to take a quick commercial break. We'll be back right after these messages. Don't go away. We've got a lot more to learn. Welcome back to Your Health Matters. My guest today is Dr. Anthony Lemansky. Thanks again for being on the program. You've shared some pretty interesting stuff with us before the break, and we were talking a little bit more about how we hypnotize ourselves, but then share with us more. What?
As I said, the hypnotherapist basically will guide people into hypnosis. And if you can teach people to use hypnosis, they can use it for almost anything, whether it's anxiety, whether it's phobias, whether it's smoking cessation.
So once you learn the basic technique, you can almost self-hypnosis or
Absolutely.
self-hypnotize, whatever the correct term is there.
It's self-hypnosis, and people can practice it on a daily basis, just like people practice yoga or
Okay.
meditation or anything of this sort. It's a learned act. And once they learn how to get to that point, then they can use it on a daily basis.
I think of many people who could use that, including myself. So how do I learn this, and how do I hook up with you about that?
Well, certainly right now I've been so busy practicing medicine I've not been able to do much in the way of hypnosis. It would be nice if we had a few more hypnotherapists in the Kingman area, but there are multiple tapes and CDs that do this on a regular basis. And the key is to get to a point where you know that you are at a level of hypnosis. And that's the difficult thing, and that's why for me, an individual session is probably the best because people then know. And then once you practice it, you can feel it and you can tell that you are definitely in a state of hypnosis.
Interesting. Okay.
It is interesting, though. You do get people, oh, I don't think I was hypnotized.
Right. Or I remember everything, so I wasn't hypnotized, right?
Well, but that's the key. Hypnotism is conscious awareness. It's awareness beyond the critical factor, and the critical factor is the conscious mind.
Okay.
If you take the conscious mind and you try to keep things in, after about 7 or 8 things, my wife tells me to pick some up at the store, that's always 8. So it's the idea, that's right, and I can't remember. Whereas the subconscious remembers everything that you've ever done, ever learned, ever said. It's all there. So you just have to learn to tap into that.
How to open those file cabinets,
Correct.
if you will.
That is hypnosis. And so the idea of being able to do that on a regular basis for a lot of people would be very comforting. What I do when I do hypnosis is have people create their own safe room without giving away a lot of it. The idea is that they get to build the double doors on it. They do it in their mind.
Make them feel safe.
Correct.
Mentally.
And as they go in, I tell them they've got this large screen TV, and on it they can pick out any time of their life.
Kind of like It's a Wonderful Life.
Absolutely. They can go back, they can go forward, and for people, especially with trying to have educational goals, I have them put a picture on there of them graduating and how good they're going to feel, and how their family's going to feel about them. So it's interesting. They can do anything there without judging themselves or anybody else.
Just kind of letting all that go.
Absolutely, because that colors our everyday activity.
Well, and I would think in our society today, as we talk about our everyday activities, you probably see more and more of people needing that because we don't give ourselves enough time to relax or slow down enough to even think about those kind of things, right? Isn't that part of it, is you have to get to a quiet place to be able to be hypnotized?
At first you do, but after a while, as I said, when I get on an airplane, people can be walking and doing everything. No, it takes me 20 seconds to get where I need to go.
Really?
Yes. So it's the idea of being able to condition oneself. And people who meditate can meditate in the middle of a storm.
True. Okay. Yeah, that makes sense.
And it doesn't have to take a long time.
So it's just getting the tools
to do such.
To do it.
And there's a lot online now, and there's a lot of people who do CDs, and
the tape.
So you could do that very easily on your own with meditation. And I use it personally. I used it for my own healing. I had both hips replaced a number of years ago.
Oh, that's right. I remember that.
And off my safe place, I had my healing area.
Okay, so like a separate room that you
No,
went to? No,
separate room. Actually, it was a door. I walked through the door, and I was at this back porch of a high mountain cabin.
Nice.
And there was a lake in the distance. There was I imagined it was in Oregon. Had a light mist to it, and of course the trees next to it were all cedar. Well, if you've ever smelled wet cedar, all I had to do was get that smell in my nose, and I was in a healing area where I could basically visualize every exercise I needed to do in order to get back doing what I needed to do. And I visited there 3 times a day, maybe only for 5 or 6 minutes.
Right.
But that's all it took. It didn't take 3 hours to do this.
Wow.
And that's why in this busy world of ours, anybody that says they don't have 3 or 4 or 5 minutes,
We've
I don't
all
believe
got,
it.
yeah,
I don't believe it.
we should all be able to carve out 3 or 5 minutes, no matter what your schedule is.
Yes.
And sometimes, maybe even just before you go to bed at night. or when you first get up in the morning.
Absolutely. And
Start your day right.
some people, we don't use hypnosis a lot for sleep, even though you can calm your mind. And I like meditation, I think better for that, but you can do that as well. And a lot of people can't get to sleep because they can't turn off their mind.
Yeah, the head's going.
Yes. But if you relax and meditate or a quick hypnosis session, you're able to get to sleep.
That's very cool. So one last thing before I forget, I wanted to ask you about, with your current patients, like with your moms to be that you see, do you share with them much about hypnosis? Is there much of that going on?
I do talk to a number of patients. There are plenty of patients who would think I was a little crackpot if I said it. But there are some who ask specifically because I have my diplomas on the wall for hypnosis and such. There is a midwife who's been out there preaching hypnosis in childbirth for almost 15 years now. Name is Mickey Mongan. And she's
not in Kingman, though.
No.
Okay.
She is, I believe well, I'm not sure where she is now. She was in California last time I remember. But she's coined the term hypnobirthing. She's even copyrighted that name. So, but you can go online and find her books, her CDs. She does 4 or 5 sessions, hour-and-a-half sessions in classes with people for this. I've had a few patients that 1 or 2 sessions, and they were just fine. They did wonderful. It was like no pain meds.
Really?
Yes.
So when they want to do kind of the natural childbirth, they choose not to they don't want to have the medications or the pain.
I suggested to him saying that medication isn't cheating and it's not like you failed. You do what you need to. Labor is one of those things that's very liquid. Things change from minute to minute.
Yes, very
quick. Accept what you can do and let us help with the rest is what I tell my patients.
That's good. That's good advice.
But I've had people use hypnosis with no problems. And so it's one of those things that I think is emerging. We're going to see more and more of that. Hopefully it'll become more mainstream.
Well, it fits in with like complementary alternative medicine.
Yes.
That's one of the things, and we've talked about that on the show before too, that there are these other forms, whether it's even therapy, physical therapy is something different, and acupuncture and chiropractic and all of those. And back in the old days, I remember my mother, when I was a little kid, thought chiropractic, anything chiropractic was, yeah, that's changed a lot, and now, they're recognized of the value they bring, and so I can see how hypnosis would be the same way.
That's why I'm hoping there'll be more in terms of more practitioners in the Kingman area. My time has just been taken up with the
delivering
babies. Clinical medicine, yes. But it's my hope that someone will come in and start it at a level that people can afford, number one.
Right.
But also people can see the benefits from this.
Awesome. Thank you so much for being on the show today. Time goes so quick when we're on here. Probably have to have you back again. I hoped you learned some stuff today. I know I did. And that you'll join us again next week. I'll have another great guest on the program for you.